Take a bunch of women who are going through labor and delivery, split them into two groups, same spinal anesthetic injection. With one group they said, you are going to feel a big sting and burn in your back now, like a big bee sting. This is the worst part of the procedure. With the other group they said, we are going to inject the local anesthetic that will numb the area where we are going to do the epidural spinal anesthesia and you will feel comfortable during the procedure. Then the researchers recorded their subjective pain levels after the procedure. And guess what happened? With the exact same injection, group 2 reported higher levels of pain. This is the power of your words. A lot of people know what the placebo effect is. The placebo effect is a fascinating phenomenon that occurs when a sham medical intervention causes improvement in a patient's condition because of the factors associated with the patient's perception of the intervention. So it's basically the idea that if you have positive expectations, you'll actually experience positive outcomes. You hear stories of people taking sugar pills and feeling better, and there's also studies conducted on switching out a name brand drug to a generic version of the drug that's identical chemically, but the patient reports that the generic version is less effective. The nocebo effect is less well known. The nocebo effect is a phenomenon that is the opposite to the placebo effect, whereby expectation of a negative outcome may lead to the worsening of a symptom. So just like a placebo effect, but in this case, a negative expectation creates a negative outcome. So with the example from earlier, there was a placebo group and a nocebo group. In the placebo group, they were basically told, this injection will make you feel better and make you more comfortable. With the nocebo group, even though it's the exact same injection, they made it seem like it's going to be a lot worse. It's going to be like a bee sting. This is the worst part of the procedure. With the same exact intervention, you changed pain perception by altering the words you said. Before we talk about communication, we first have to understand where our patients' beliefs come from. And that's exactly what this research did. They looked at 130 patients with persistent lower back pain, and they asked them about their beliefs regarding their pain. And they were able to group these patients' responses into 4 main categories. So the first group was body as a machine. These patients felt like the body is like a machine, and since they have pain, that means something is broken in them. And there's something mechanically broken and needs to be fixed. Number 2, lower back pain is permanent and immutable. This is similar to the first category where these patients feel like, so since I have back pain and I've had back pain for a while now, that's just something that will stick with me forever. The third category, lower back pain is complex. These patients are more open to the idea that it may not just be the biomechanical factors. Number 4, lower back pain is very negative. Lower back pain is conceptualized as abnormal. These patients are constantly thinking about it. Lower back pain should be avoided at all times. What's interesting is that these researchers actually asked these patients where their beliefs came from. And if you look at this table, you can see that the majority of patients got their beliefs from healthcare providers and then their internet. This shows that what healthcare providers tell patients is very heavily weighted and patients take it very seriously. But the problem is, research shows that a lot of asymptomatic people have some sort of abnormality in their bodies. 37% of people in their 20s have some form of disc degeneration in their spine. And by 50% of people have some form of disc bulging. And this study was conducted on people without back pain. In healthcare, we like to perpetuate the idea that structural damage equals to pain. And the problem is that we can spread those beliefs onto our patients, and that leaves patients with a permanent problem. Because maybe if 2 people both have bulging discs in their spines, one has pain and one doesn't, maybe there's a possibility that the one with pain can live life without pain. And there's hope in that. I think we need to do a better job of giving that patient hope. Depending on the study you look at, the lifetime occurrence of lower back pain is as high as 70%. So from what it seems like, most people will have lower back pain at some points in their lives. So maybe lower back pain is a normal part of life, just like these abnormalities that show up on imaging. And we know that a lot of times acute lower back pain is self-limiting, non-specific, and will get better over time. I think we can do a better job of calming patients down, explaining that a lot of people have some form of lower back pain throughout their lives, but also a lot of people get better. And the good news is that most lower back pain is non-specific. We can do a better job of reassuring patients that through movement and a little bit of activity modification, we can really calm your system down, and from there you can progress patients back to doing their meaningful activities. Because I think one of the biggest tools as clinicians is to debunk myths and beliefs that may be harmful. Try to reinforce the fact that there is hope and help patients to gain back control in their lives. Because once they realize that the body is not like a machine, that's very hopeful, and that means that their condition is not permanent. And as always, if you like this type of content, subscribe and there's more to come.